In this video, we are going to deal with seronegative spondyloarthropathies SPA. We are going to deal with seronegative spondyloarthropathies, and it is like when we look for definition, it is a group of disease, group of intolerated inflammatory rheumatic disease. It is characterized by there is like negative rheumatic factor. There is absence of rheumatic factor. And there is presence of enthesitis. It means there is inflammation of like tendons, ligament, tendon, inflammation. There is not synovium involvement, and mainly in this disease there is like sacroiliac joint involvement. When we look for the like association of some gene, like there is HLA-B27 association gene, and like there is bony proliferation. That bony proliferation lead to the ankylosis. In this disease, like there is this disease characterized by negative rheumatic factors and enthesitis and sacroiliac joint involvement, and the HLA-B27 is associated with association occur in this disease, and also there is a bony proliferation that lead to the ankylosis. It is the characteristic feature of this disease. Disease seronegative spondyloarthropathies. So in this disease there is immunopathy. When we look for immunopathy, there is some involvement of T cell mediated. It is T cell mediated, and there is like triggered. It is triggered by like microbial agents, microbial antigens, and that leads to cross reaction or and let with self tissues. Due to this microbial antigen, there in the like body antibody cross react with our self tissue, and that this type of inflammation occur. And there is also role of HLA-B27, but their accurate mechanism. It is antigen presenting. It is suspected as antigen presentation, but there is not exact mechanism. Exact mechanism is known. Exact mechanism is unknown. In this mechanism is unknown. So this is regarding seronegative spondyloarthropathy. So there is some diseases in this classification. Like first is ankylosing spondylitis. Yes. Regarding this disease, in this disease there is some target joints. target joints like sacroiliac joint. Another are like vertebral, apophyseal, epiphyseal joints are involved. So looking for this ankylosing spondylitis, there is some clinical features. In clinical features, like there is chronic back pain, there is patient presented with a chronic lower back pain due to the sacroiliac joints, and there is also uh, spine immobility occur in the patient. There is onset of in the patient, onset second to third decade. And when look for the peripheral joints, like peripheral joints. When we look for the peripheral joints, there is involvement of hip joint, knee joints and shoulder joints involved. Like involved one third of cases or patient cases. So when we look for the HLA B27 positive or negative, so there is HLA B27, like 19% of cases have positive. And when look for pathology, in the pathology there is like articular cartilage destruction occur, destruction, and there is also bone fusion occur, and this bone fusion lead to ankylosis. Like there is a joint, like this is a joint, and this is a joint, it is mobile, so there is the joint, there is fusion of joint that lead to the immobility of the bone, immobility of joint. And it is regarding ankylosis spondylitis. So now we are moving on. Reactive arthritis. So moving on. Reactive arthritis RA. Rheumatic arthritis RA, and this is reactive arthritis RA, short form. So it is an acute inflammation. This disease is acute inflammation. Due to the inflammation, but acute inflammation occur in this case, and there is like followed by infection. There is also infection. This inflammation lead by the infections. Often that lead to the arthritis, this is done often with the like urethritis or cervicitis, and there is also conjunctivitis. So commonly this disease is commonly triggered by like genitourinary infections, like chlamydia, trachomitis. This infection lead to the like this type of inflammation in the joints, And there is also GI microbes or bacteria like Shigella, infective agents like Shigella, Salmonella, Yersinia, Campylobacter, and there is Clostridium difficile. Clostridium difficile. These organisms lead to the reactive arthritis, and there is acute inflammation on the joints. So it's also occur in the case of the HIV positive patient individuals. Like one look for the clinical feature of this disease: reactive arthritis. Clinical features. In the clinical feature, there is asymmetrical, like involvement asymmetric oligo arthritis, like most commonly involvement of knee joints, lower limbs joint, and one look for the inflammatory. There is also inflammatory low back pain, like in clinical presentation inflammatory low back pain, and there is formation of enthesitis, like where it is a bone. Then here is the attachment of insertion of ligament or tendon. There is here is inflammation going on, and this is known as enthesitis. Like mainly in this case presented with a child tendon, plantar fascia, lead to the heel swelling, that lead to the heel swelling, and also patient presented with another is dactylitis. It means like sausage, like fingers, like digits due to synovitis. Like when we look in the image, there is sausage like inflammation, and it is called as dactylitis, like sausage formation of the digits. There is swelling of the digit, and when we look for the enthesitis, there is this tendon, this ligament have inflamed. This ligament has inflamed in this region. We can look, it is inflamed, so it is known as enthesitis. So dactylitis we have covered. So there is some chronic case. There is bony spores, and ossification of tendon. There is ossification going on. Ossification of the at a tendon where that is inserted. Insertion occur. Insertion. Like in this image. One look. This is like a tendon or ligament, and this is a tendon. So there is a origin point, and there is a insertion point. So at the insertion point, there is ossification going on. Ossification start at the insertion point. Then there is also extra-articular manifestation. Like there is conjunctivitis, uveitis, there's urethritis, and blanitis, and also sorbicitis. So there is mucosal ulcers, skin rashes, and nail changes, like psoriasis, nail changes, like psoriasis. And when we look for the HLA, in this case HLA P27, so there is like positive in many cases, not a specific, but many cases are positive cases. And there is like in the course, look for the course, like there is episode of wax and wane over 6 months, and more than 50%, more than or equal to 50%, is tends to 50% recur or become chronic. This is all regarding the seronegative spondyloarthropathies. So I hope you have clear. So there is like conjunctivitis, there is like conjunctivitis, and there is enthesitis, and like dactylitis, swelling of such as like finger, dactylitis. This is a triad: conjunctivitis, dactylitis, and enthesitis.